The Doctor's Journal, brought to you by Medical Associates Hospital, Jameson and O Snacks.
Welcome to another episode of the Doctor's Journal. Wait, I think something is...
Yeah,
kind of off. Better, right?
so much better.
Nice.
Today, we focus on a common eye condition that affects millions worldwide, cataracts. According to Vision Atlas, 6.2 million persons in the Caribbean were reported to have vision loss, with an estimated 100,000 persons reported to be blind in 2020.
Crazy, right?
Very!
Well, not really.
Yes, it is!
Anyway, in this episode, we explain who are most affected by this disease and how we can treat and prevent it. Welcome to this episode of the Doctor's Journal. So what exactly are cataracts and how do they affect vision?
Well, Dr. Mike, a cataract is a clouding of the eye's natural lens, which lies behind the colored part of the eye, which is called the iris. The clouding occurs when proteins in the lens clump together over time, causing vision to become blurry, hazy, or even less colorful.
Yes, Dr. Sunarayan, cataracts can lead to difficulty with daily activities like reading, driving, or recognizing faces. So what are the typical symptoms of cataracts?
The symptoms of cataracts can vary, but some common signs include blurred or cloudy vision, increased sensitivity to glare, difficulty seeing in dim light, and fading of colors. Some individuals may also report a double vision in one eye.
So who is at risk of developing cataracts? We'll tell you more after the break.
Welcome back. Before the break, we began the discussion on cataracts. But what are some of the specific risk factors?
Cataracts are most commonly associated with aging, but certain risk factors can increase the likelihood of developing them earlier. These risk factors include excessive exposure to sunlight without eye protection, smoking, certain medications like steroids, a family history of cataracts, and one of the more common associations is certainly diabetes.
While cataracts cannot be entirely prevented, there are some measures individuals can take to reduce their risk or even delay their onset, like wearing sunglasses with UV protection. That's important to note. And quitting smoking and obviously managing your diabetes effectively. Also, maintaining a healthy diet rich in antioxidants is also beneficial.
And you want to do regular eye exams, which are crucial for early detection and treatment. So how do we diagnose cataract?
Diagnosing cataracts involves a comprehensive eye examination by an eye care professional. This includes a visual acuity test, dilated eye exam to evaluate the lens's clarity, and tonometry to measure the intraocular pressure. These tests can help determine the extent of cataract development and its impact on vision.
Yes, Dr. Sunarayan, the only effective treatment for cataracts is surgery. During cataract surgery, the cloudy lens is removed and replaced with an artificial intraocular lens to restore clear vision. Cataract surgery is generally safe and has a high success rate in improving vision.
That's right, Dr. Mike. Cataract surgery is one of the most common performed surgeries in the world, and it's considered a safe and routine procedure. It is typically performed as an outpatient procedure, and most patients can resume normal activities within a few days.
Yes, there are different types of intraocular lenses available, each with its own advantages. Monofocal lenses provide clear vision at one distance, usually for distance vision. Multifocal lenses or accommodating lenses can provide clear vision at multiple distances, reducing the need for glasses.
Cataract surgery recovery is generally straightforward. Patients may experience some mild discomfort or itching in the eyes for a few days. and the vision might be slightly blurry initially, and it's essential to follow the surgeon's post-operative instructions carefully, which includes using the prescribed eye drops. Most individuals can resume normal activities, like we said before, within a week or two after surgery.
When we come back after the break, we share what you need to know about cataract surgery. Stay tuned.
Is it difficult for you to go to the doctor? Then call us today and get a doctor at your doorstep. Our qualified team of doctors are ready to help, and we specialize in convenient at-home care, including blood tests, pap smears, diabetes management, vaccination, and so much more. Get the care you need and get a doctor at your doorstep. Call 480-4DOC to set up an appointment or to get more information.
At Athena Clinic, we're committed to helping you boost your confidence and live your best life. Enhance your appearance with a non-surgical procedure or optimize your health with one of our expert doctor consultations and diet and fitness plan. Call today at 282-2262.
Welcome to the Doctor's Journal. Before the break, we promised to share with you cataract surgery and more on it. Here with us today, we have Dr. Deo Singh, consultant ophthalmologist. Welcome to the program.
Thank you very much.
Can you start by explaining what is cataract and how they can develop cataract in the eye?
Yes. So, cataract is a loss of clarity of the human lens. Each eye is equipped with a lens which sits near the front of the eye, just behind the colored part of the eye.
Right.
And its function is to help focus images onto the retina so that we can see clearly. And therefore, in its normal, healthy state, it's transparent, like the clear glass window.
So when it's not healthy, what color is it?
It becomes clouded. It can become white, it can become brown or yellow, depending on the stage of the cataract.
Okay, so what are the common signs and symptoms individuals might experience with cataract?
Some of the commonest signs are really not picked up by the patients.
Okay.
In that, as we grow older, we tend to think that the effect of oncoming lights is because those people have too much the lights are the cars are fitted with brighter lights now than before, and those
dazzling their
rogues are always driving on their high beam, but really not so. It is because the early onset of cataract is associated with glare intolerance, glare sensitivity.
And what age does that usually start to happen for people?
Very often in the late 60s.
Okay.
We lose the color.
Right.
So colors become faded, and generally that would not be noticed by the patient unless for some reason one were to block one eye and the other and start comparing, because very often cataract develops at different rates in the two eyes.
Oh,
so
when you block one, the color looks different. And that's a good note, though.
And then, of course, as we said, the function of the lens is to focus on whatever we're looking at. And so blurred vision is another significant symptom.
Okay, nice. So cataract is also associated with aging, right? Can you clarify the role aging plays in the development of cataract?
The lens in the eye continues to grow throughout life. What happens is that there are cells in the outer areas of the lens, beneath the lens capsule or lens membrane, that continue to produce lens fibers.
So it keeps coming over.
Right. So they grow from the outside, like the onion rings. Yeah. And they compress and compact the inner fibers.
Right.
So these fibers then form what we refer to as the lens nucleus.
Right.
They are compressed, they become less hydrated, the protein is denatured, and the color changes.
Right. So this is again where we get the yellow and the browns.
Correct.
Right.
Yeah. So it gets yellowish, and then it gets brown, and then some people kind of present very late, and it looks sort of like Guinness bottle.
Okay, that's really dark though.
That's really dark, yes.
Right.
Yeah.
So how, as we talked about that, how is cataracts diagnosed, and what are the steps someone can take if they suspect they have cataract?
Diagnosis is at the office of the ophthalmologist, optometrist, where we have the advantage of the eye drops that we use to dilate pupils. So if we suspect a cataract, we'll dilate the pupil with these drops so we have a better view of the lens of the eye using our slit lamp microscope. So this microscope is the standard equipment in the eye care provider's office. It produces a slit beam that creates an optical section through the eye, through the cornea, through the lens, and so we can observe the color of the lens and the changes that are taking place.
Okay.
So there are no special, what do you call it, special testing, special investigation.
They first have to always do that slip.
So
Okay.
it goes with the symptoms, of course, and then the signs we pick up in the office.
Okay, so what are the treatment options available to us here in the Caribbean?
So the treatment options that are available to us in the Caribbean are the same treatment options that are available anywhere, really, in that the primary treatment is surgical, and the technology that is used anywhere is phacoemulsification cataract surgery. What does that mean? It means that we use a very small probe of the order of about 2.2 or 3 millimeters.
That's so
Very
small.
fine, yes.
That's the
very
size
tiny.
of a hair.
And that generates an ultrasonic wave that emulsifies or liquefies the cataract, thereby allowing us to aspirate or suck it out through a very small incision.
Right.
The advantage of which is that we do not need sutures, so we don't put stitches generally, or in most instances in cataract surgery. The healing is faster, the discomfort is less, and the dry eye associated with cataract surgery is also less.
So as we talk about those lenses, what are the different types of intraocular lenses?
The commonest lens used is what we refer to as a monofocal lens.
Right.
It's been around the longest. It stood the test of time. It has a high level of acceptance by patients. It corrects vision for a specific distance, and most patients prefer to have good distance vision.
Right.
Then there are the more recent lenses, the multifocals, that correct for distance, intermediate, and near. Now, it's not like a one-size-fits-all situation. Some eyes are not suitable, and some patients are not suitable for multifocal lenses.
Right.
So it is a decision that has to be made with balance in discussion between the patient and the ophthalmologist.
What's the biggest factor that contributes to them not being able to get multifocal lenses?
Okay, so we need to exclude certain diseases. For example, patients who have significant dry eye disease,
Right. Okay.
who may have corneal diseases like corneal high astigmatism, keratoconus, irregular astigmatism,
Right.
an irregularly shaped cornea is a contraindication. People who are diabetic with diabetic eye disease or macular degeneration.
Right. No, so this is only for multifocal, but with people with these conditions, can they get monofocal?
Yes, indeed.
Right. Okay.
Indeed. And another group of people to be wary of are people who have collagen vascular disease, like rheumatoid arthritis,
That's an important one. Right.
lupus, and so on. They are prone to developing severe dry eyes and inflammatory eye disease and so on. So they should probably not have multifocal lenses.
Right. So what can individuals do to prevent or to delay the onset of cataract?
Yes. We live in a very enjoyable climate.
The
A lot
sun.
of sunlight. It does a lot of good. I mean, but
Helps with vitamin D, but
but the cumulative exposure over your lifetime to the UV light results in an earlier onset of cataract in our climate as opposed to temperate climates. So our people begin to develop cataract a decade earlier than those people in the
a lot of time
in
earlier.
the temperate climates, like in the United Kingdom and so on.
Right.
Yeah. And so hence the reason that we advise the use of UV protection.
Right, so all about shades, but it must say UV protection.
UV protection in shades. And of course in your prescription lenses they can incorporate that as well. And people who are outdoor workers should protect themselves like that. It helps. It delay the onset. Maybe it prevents you from developing a cataract after all. Maintain a good level of hydration because the hydration level varying doesn't do good for the metabolism of the lens as well. People who are diabetic should maintain a steady control of their diabetes, because when the diabetes goes out of control and the sugar level rises, it rises in every tissue in the body. It rises in the lens of the eye, and accompanying the sugar within the lens is water. So the lens becomes swollen. So it's fluctuating in size and water content, and that is that predisposes to the development of cataract. So those are some of the measures that one should be aware of in maintaining your diet, your hydration, diabetic control, UV protection.
Is there anything else you want to tell our viewers at home?
Yes. So cataract is eminently treatable. Cataract is treatable surgically. There is, as far as we know as of now, no eye drop or dietary measures that gets rid of cataract. We appreciate that some people may not be able, for health reasons, to undertake cataract surgery when it's diagnosed. However, and those persons may benefit from some improvement. It might not be optimal, but they might benefit from some improvement to tie them over in the spectacles. Delaying cataract surgery increases the risks of surgery.
Wow, okay.
So that when we talk about mature cataracts, it puts more stress on the cornea, and following cataract surgery, we may develop decompensated cornea. The cornea may go bad, put it that way, and need corneal transplant surgery.
Wow, okay. So better operate quickly.
I'll give you a recent story. I saw a lady around 40-ish, and when she came to the office, there was not a smile on her face, and she was being led by a relative. And she had bilateral white cataracts at age. And so she had her first cataract surgery done, and immediately we finished surgery in the operating room. I sat her up on the table, and I didn't put any patch on, so I wasn't going to put a patch for her. I saw her looking at me and smiling. I said, "Have you seen me before?" She said, "No, but I now see you." I said, "But I have seen you before." She says, "I know, I was in the office." And then she had her second cataract operation done 2 weeks later. Right. And fortunately for her, she's got 20/20 vision. And she's off to get married in 2 weeks' time.
Oh, that's exciting times then.
Yeah. No, but so the thing is that, cataract is a surgical condition. The outlook for cataract surgery is that 99% of people plus will end up in the absence of other eye disease like diabetic eye disease, macular degeneration, advanced glaucoma. Excluding those persons, 98% of people will have a vision of 2020 or 2040, in that range, so they can function for most things without spectacles.
Right. And for the
There
most
are
part, it's
risks.
a safe surgery.
It is the risk of blinding outcome in cataract surgery is of the order of 1 in 3,000.
Okay.
So the news is good, the technology is available,
And it's always
And-
advancing.
and cataract surgery is the commonest, I might even say, life-changing surgery that is done anywhere. I gave you an example a while ago.
Yes. Thank you so much, Dr. Singh, for joining us. We learned so much about cataract. So stay tuned for more.
Are you looking for a customizable studio space with green and white screen cyclorama and professional production equipment to carry out your next big project? SGP Studios is the perfect fit for you. TNT's largest studio space with an overhead lighting grid and sound treated, perfect for television commercials, music videos, television programs, social media content, and film productions. We also have a wide range of production equipment available for rental. You can choose from a selection of Netflix approved cameras, modern lighting equipment, professional audio gear, 40-foot and 20-foot cranes, gimbals, drones, lenses, action cameras, and more, all at competitive prices. Whether you need a high-end cinema camera for a feature film shoot, specialized lighting equipment for a music video, or audio gear for a podcast, we've got you covered. And with our easy online booking system, you can reserve the gear you need in just a few clicks. Check us out online at sgpstudios.com.
Hi everyone, I am Nandini Samuel, your registered dietitian, and today we are going to be speaking about the role of nutrition in your eye health. I am sure while growing up you always hear the saying that carrots and pumpkin are good for your eyes. Well, according to research, the risk of cataracts can be prevented by a diet rich in vitamin C, lutein, zeaxanthin, B vitamins, and omega-3 fatty acids, whilst vitamin A, E, and C showed beneficial effects on age-related cataracts. Limiting sugar-sweetened beverages and snacks, meals high in simple carbs and fats is very important in the prevention of diseases such as diabetes, which can in turn lead to an increased likelihood of cataracts, in addition to if you have a very high BMI. As you can tell, today I'm going to prepare a very healthy but fun recipe. It's definitely an antioxidant blast. So usually on very hot days, even when we feel like doing a twist to your water, we can do infused water. So here we have our glass pitcher. First we are going to add in our lemon slices, and guys, you could add any fruit or vegetable that you like. So let's just say that you like oranges instead, you could add that. To your jar, we have some peaches here, some sliced peaches. Then we have our star fruit, or what we call 5 fingers here in Trinidad. And our carrots. First we want to add our water into our pitcher. Then we are going to give it a fancy twist, so we are going to make it into a mocktail. We're going to add our cran water. And then our sparkling water. Or you could also use any sort of fizzy drink into here. Mix it thoroughly. And you can have it either refrigerated or hot. And there you go, guys. A healthy infused water. That's great for your eyes.
This segment was brought to you by O Snacks.
I want to emphasize the importance of regular eye exams, especially as we age. Early detection of cataracts allows for timely intervention and better outcomes.
Cataract surgery can significantly improve the quality of life, and restore clear vision for those affected.
You've been watching the Doctor's Journal. I'm Dr. Mike.
And I'm Dr. Sunarine. Take care of you for us.
The Doctor's Journal was brought to you by Medical Associates Hospital, Jameson and O Snacks.